Welcome to ER Mentorship Hub. Today we will into a critical aspect of forensic medicine in the emergency department. Recognizing and understanding strangulation injuries. Today, we're going to explore the lethal nature of manual strangulation, often seen in cases of intimate partner violence, and its implications in forensic medicine. Let's begin with a case study. Jane, a 35-year-old woman, was brought to the ER following an incident of domestic violence. She displayed signs of strangulation, including difficulty speaking and visible neck injuries. Clinical presentation. Initial assessment. Upon arrival at the emergency department, Jane was visibly distressed, with notable redness and bruising around her neck. She was able to speak, though her voice was hoarse, and she complained of pain during swallowing. Symptom details. Jane recounted a terrifying experience where she felt an intense pressure on her neck, leading to a rapid onset of dizziness and blurred vision. She described a sensation of ringing in her ears, followed by a complete blackout. Loss of consciousness. The loss of consciousness Jane experienced is a critical symptom, occurring when the brain is deprived of oxygen due to the occlusion of the carotid arteries. This interruption in blood flow can lead to unconsciousness in just seconds, depending on the amount of pressure applied. Anoxic brain injury indicators. A particularly concerning detail Jane mentioned was a brief loss of bladder control during the assault. This involuntary action signifies a deep anoxic insult to the brain, where it has been deprived of oxygen for at least 15 seconds. Such a symptom underscores the severity of the strangulation and the immediate need for medical evaluation. Additional observations. During the physical examination, Jane exhibited signs of petechial hemorrhages in her eyes and intraoral mucosa, indicative of the increased pressure on the jugular veins leading to capillary rupture. These clinical findings, coupled with her neurological symptoms, painted a clear picture of the violent strangulation she endured. Emergency response. The medical team quickly initiated supportive care, focusing on monitoring Jane's airway, breathing, and circulation. Given the potential for swelling and further airway compromise, they remained on high alert for any signs of deterioration. Lethality and control. In the grim spectrum of intimate partner violence, manual strangulation stands out due to its lethality and the message it conveys. This act goes beyond physical harm, it's a chilling assertion of dominance and control. The perpetrator, by exerting physical force on the victim's neck, demonstrates a terrifying level of power over the victim's very life and breath. Implications for victim safety. Strangulation in domestic situations is a significant predictor of future lethal violence. It's a critical red flag that warrants immediate intervention and safety planning for the victim. Understanding this dynamic is essential for healthcare providers, as it guides the approach to care and the urgency in addressing the victim's safety concerns. Physiological impact. Mechanism of harm. When an assailant strangles a victim, they apply pressure to the neck, compressing the carotid arteries and jugular veins. This action restricts blood flow to and from the brain, leading to cerebral hypoxia or anoxia. The pressure needed to obstruct blood flow in these vessels is surprisingly low, making strangulation a particularly insidious form of assault. Symptoms and warning signs. Victims of strangulation may experience a range of symptoms as their brain becomes deprived of oxygen. These can include visual disturbances like blurring or darkening of vision, auditory changes such as ringing in the ears, and a feeling of lightheadedness or dizziness. These symptoms often precede loss of consciousness and indicate an imminent risk of severe brain injury or death. Subtle yet serious. It's important to note that strangulation may leave little to no external signs, making it a hidden yet potentially fatal injury. Victims might not have visible neck marks, but could still suffer from serious internal damage, including carotid artery dissection, vocal cord injury, and neurological deficits. Recognizing signs and symptoms. Petechial hemorrhages. Understanding the mechanism. Petechial hemorrhages are pinpoint red or purple spots that result from tiny blood vessels bursting under the skin. In strangulation cases, these hemorrhages are caused by the increased venous pressure due to the obstruction of blood flow back to the heart. When the jugular veins are compressed, this pressure increase leads to capillary ruptures. Common sites of appearance. These hemorrhages are most easily observed in areas where the skin is thin, such as the conjunctiva of the eyes, the eyelids, and the intraoral mucosa, including the soft palate and the posterior pharynx. Their presence in these areas can be a critical indicator of strangulation, even in the absence of external neck injuries. Assessment in clinical practice. In the emergency department, a detailed examination for petechial hemorrhages is essential in any suspected case of strangulation. Utilizing tools like an ophthalmoscope or an oropharyngeal scope can aid in identifying these subtle yet significant signs. Neurological changes. Range of symptoms. Neurological changes resulting from strangulation can vary widely, from mild symptoms like dizziness and tinnitus, or ringing in the ears, to more severe manifestations such as loss of vision, altered mental status, or loss of consciousness. These symptoms result from the brain being deprived of oxygen and nutrients. Significance of anoxic injury. The occurrence of neurological symptoms, especially loss of consciousness, is indicative of a significant anoxic injury to the brain. This is a critical finding as it implies that the brain has been without adequate oxygen for a period long enough to cause unconsciousness, which can have long-lasting effects. Delayed presentation. It's important to recognize that neurological symptoms may not present immediately. In some cases, victims may experience delayed neurological sequelae, which can manifest hours or even days after the incident. Continuous monitoring and thorough neurological assessments are therefore imperative. Quick unconsciousness. Physiological mechanics. The rapidity with which a victim can lose consciousness during strangulation is alarming. With just 11 pounds, or around 4 kilograms of pressure, the bilateral occlusion of the carotid arteries can cut off blood supply to the brain, leading to unconsciousness in less than 8 seconds. This swift progression is one reason why strangulation is so dangerous and potentially lethal. Emergency response. In the emergency department, understanding the speed at which strangulation can affect a victim is vital for triage and immediate medical intervention. Quick assessment and treatment are essential, especially considering the potential for anoxic brain injury and other life-threatening complications. Forensic significance. The rapid onset of unconsciousness in strangulation cases also has forensic implications. It highlights the need for thorough investigations into any reported incidents of strangulation, as the severity of the assault may not always be immediately visible. Documenting the duration and method of strangulation can be critical in legal contexts, as it provides insight into the assailant's intent and the potential for future harm. Identifying marks and evidence. Ligature marks. Characteristics and identification. Ligature marks are often one of the most telling signs of strangulation. These are typically left by an object, such as a cord, rope, or belt, used to apply pressure to the neck. The marks can vary in appearance, from distinct linear abrasions to subtle redness or bruising, depending on the type of ligature used and the force applied. Location and pattern. These marks are usually found encircling the neck, often with a consistent pattern or imprint reflective of the ligature material. In some cases, the marks may be more pronounced in certain areas, indicating the direction of the force or the position of the victim during the assault. Forensic relevance. In forensic investigations, the analysis of ligature marks can provide vital information about the nature of the assault. For instance, the width and depth of the marks, their location, and the presence of any knot or crossover patterns can help reconstruct the event and potentially identify the weapon used. Absence of external trauma. Understanding the complexity. It's crucial for medical practitioners to understand that not all strangulation cases present with visible neck injuries. In some instances, particularly in manual strangulation, there may be little to no external evidence of trauma. This absence does not negate the severity of the assault. Internal injuries. The lack of external marks can be misleading, as significant internal injuries can still occur. This includes damage to the neck structures such as the larynx, trachea, and blood vessels, which may not be immediately apparent on external examination. Diagnostic challenges. This characteristic of strangulation poses a challenge in both medical and legal contexts. Clinicians need to maintain a high index of suspicion in cases with a history suggestive of strangulation, even in the absence of visible neck injuries. Detailed documentation and potential imaging studies like a CT scan or MRI may be necessary to identify internal injuries and support forensic investigations. Pearls of forensic medicine. Increased risk of homicide. Statistical correlation. Research in forensic medicine has consistently shown that victims who have experienced strangulation are at a significantly higher risk of being victims of homicide in the future. This statistic underscores strangulation as not just an isolated act of violence but a strong predictor of potentially fatal outcomes. Implications for victim safety. Recognizing a history of strangulation in cases of domestic abuse is crucial. It necessitates immediate safety planning and intervention strategies to protect the victim. This knowledge impacts legal proceedings, guiding the urgency of protective measures and influencing bail and custody decisions. Awareness and training. The link between strangulation and increased homicide risk highlights the need for comprehensive training among medical professionals, law enforcement, and judicial personnel. Understanding the gravity of strangulation can lead to more appropriate responses, potentially saving lives. Understanding strangulation injuries is vital in both treating victims and aiding forensic investigations. Jane's case is a stark reminder of the severe consequences of such injuries. Stay informed and vigilant. If you found this video informative, please like, share, and subscribe to ER Mentorship Hub for more insights into emergency and forensic medicine.